Hi, my name's Sherry DeCrenza, and I'm the Executive Director with the West Volusia Regional Chamber. We are here today at the City of Deltona, and Deltona Means Business, doing our monthly chamber chat. So we're super excited today. We have some great guests with us, and I'm happy to introduce them. First, I'll start off with the Medical Director for Family Health Source, and that is Dr. Joseph Rosado. And then I also want to introduce to you the Director of Business Development, Jason Frederick.
How you doing?
So we're really excited about Family Health Source. They've been a member of our chamber for quite some time. They have been involved in this community, we believe, for 15 years or more. And so, you know, I'm going to turn it over to these guys, and I want them to tell you a little bit about it. One reason that we are super excited today to be here is we're about to do their grand opening ribbon cutting on the 17th of November. From 5 to 7 p.m. we will be doing their ribbon cutting, welcoming in the public. Come join us. We're going to have some media coverage because they brought the most beautiful facility to Deltona. It's off of Deltona Blvd, right next to Crunch Fitness and that shopping center. And if you haven't been there, I'm telling you, it is so beautiful. The kids section is amazing. The interactive computer wall. So your kids aren't going to get bored. But I'm going to let them tell you a little bit more about it. So Dr. Rosado, welcome.
Thank you very much. It's a pleasure being here. How I came about getting involved with Family Health Source back in 2015, I was working as a temporary physician, locum tenens is how it's called, and I was doing like 3-month contracts with different clinics, and there was a need here in Deltona. I was living in the Panhandle at the time.
Wow.
Yeah, so I would drive 7.5 hours on a Sunday.
That's commitment.
Stay Sunday evening, see patients Monday to Friday morning, and then Friday afternoon, because we only work half a day on Fridays. Right. My last patient, I would virtually see them like on my way to my vehicle. I'd get in my car and drive 7.5 hours back home, spend Friday, Saturday, and then Sunday back to Deltona. And at the time, I started covering Deltona from March of 2015 until June, and then I had another gig that I had to complete. And so I did that, and then I got called back to come in August of 2015, and I stayed until the end of the year. And so that was my relationship with Family Health Source. That's how I heard about it. That's where I met, our CEO, Lori Asbury, who has been a phenomenal strength in the community and in the building of Family Health Source.
Yeah, she's a great advocate. Well, something
and a veteran.
Yeah, and
that
a veteran.
Is awesome. Yeah. I did not know that.
Air Force.
Yes.
Right?
No,
I'm sorry. No, Army, correct?
Yeah.
I'm going to be in trouble for that one.
Oh, you're in trouble.
You might need to edit that one out, guys. I apologize.
Jason apologizes.
No, in fact, she was a paratrooper.
Yeah.
Wow.
Yeah. One of the few women.
Impressive. Exactly, to be a woman and do that. Yeah. That's amazing. Well, something must have really drawn your heart to come back to Deltona and leave the Panhandle. You must have really loved this area.
Well, the area, but also the service that we're providing to the community. The fact that we have so many services. We provide pediatrics. We have pharmacies in 2 of our locations, in our DeLand location as well as in our Deltona location. We have a location in Pearson, which was the flagship. That's where we actually began. Yeah. In fact, our CEO lives in Pearson. Okay. So we started in Pearson. Then we have on the east side of the county, we have in Daytona Beach on Belleville Road. Together with that, we have DeLand, and then 2 locations in Deltona. The 24,000 square foot location on 1200 Deltona Blvd, but we also have a smaller location where we're presently just doing COVID testing and the antibody testing or treatment for COVID at the 2160 Howland location, right next to the subway in the Publix Lowe's Plaza.
Right.
We're there providing everyday COVID testing and the antibody Regeneron treatment for those people that either tested positive for COVID or have been exposed to someone with COVID.
Well, then that location's been really busy.
Yes, ma'am, it has. Yeah. Our numbers have been doing well. In fact, Jason could talk about what we did originally when the pandemic hit and what we did at the county fairgrounds.
Yeah, that was, so to give you a little bit of background about myself.
Yeah, please.
Originally, many moons ago, and I say that because a lot of people don't think that I'm young, but in my early 20s, I started a business that did revenue management for community health centers, and that's what Family Health Source is. We are a community health center.
Exactly.
We're here for the community and all aspects of the community. Family Health Source was a client of mine, and so I served them. Fast forward a few years, I sold the business, and it was kind of, where do I want to go from here? And about that same time, Lori Asbury, once again, she reached out to me, and she's like, hey, you know, we have these COVID issues going on. There's all these challenges. Are you still in the business? What's going on? And she's like, well, why don't you come out and see what we're doing? So I drove out to Deltona, just as a conversation, just to see what she's doing. I hadn't spoke to her in years. And she's like, are you interested in coming and helping us run the operations? And at the time, I was like, you know, this would be kind of cool. You know, I'd never been on this side of the fence.
Yeah.
I'd always been on the other side.
Yeah.
So I thought about it, had a conversation with my wife, and said, you know what? Yeah, I'm in. So right in the thick of COVID in 2020, I joined the team, and it was, at first we were doing COVID testing in parking lots, and then immediately following that, my first day on the job, we started the only COVID testing center in Volusia County as far as a mass COVID testing
At
center.
your new location,
No, I was
right?
at Volusia County
Oh, okay.
Fairgrounds.
Oh, okay.
Yeah, so we're out there testing for COVID, and we were doing upwards of 1,000 tests a day.
Wow.
We had so many people coming in, we'd have to shut the gates down
right.
at like 2 or 3 o'clock in the afternoon, just so we can make sure we can accommodate everybody. And we did that for upwards of a month, I believe. Took a break, regrouped, and then I switched over to the antibody testing. And then the same thing, just boom, 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 busy, busy, busy. So it's been kind of, you know, talk about jumping into the weeds. It was, you know, all right, welcome to, you know, your new position, and welcome to the team. Now let's figure all this out. So it was pretty exciting.
Well, at least jumping into that new position, you stayed busy. There was no downtime.
There was no
Had to learn
downtime.
it quick.
Learned it quick. You know, I thought I knew a lot about community health centers and what they offered, but like I said, once I came to this side of the fence, my mind was blown.
And you knew you made the right decision.
I made the right decision. It was something that I knew I was giving back to my community.
Yeah.
And coming from this side where I served them, I knew how much potential they had to expand services. And you know, we have this big misconception that we're only here for uninsured, or I hate to even say the term, but it gets thrown around so much. People classify us as we're here for the poor people. We're not.
Right.
We're not.
Right.
We're here for the community. You know, we started in Pearson, as Dr. Rosado said, because there was a medical desert. They had no healthcare available. So that's where we started, as a rural community health center. But we've expanded. And we've got this new lovely location, Deltona, which it is just amazing.
It's so beautiful.
When you walk in there, it's like you were saying, it's a state-of-the-art facility. We have all of our services offered, plus we have specialties that we're bringing on board. Dr. Rosado can probably talk a little bit more about that.
And hit on that, because when I went and toured it, I was like, oh my gosh, like it is truly your one-stop shop for medical.
That's actually what it's legally called. Is the Deltona One Stop.
Because you guys, I know, and you know, don't mean to take it away from you, but you had dental.
Pediatric dental.
Pediatric dental.
Right, and then you had female services.
Women's health, yes.
Right, and then what else?
We have the pharmacy there.
Right.
Together with the pharmacy, we have 4 adult medicine providers. We have a pediatrician on site. We're getting ready, starting in January, to bring on a nurse practitioner that specializes in pediatrics as well. So we'll have 2 pediatric providers to go with the 4 adult providers.
Yeah.
And then, you know, all the other services. But we're looking to expand. Starting next year, we'll have optometry to do eye exams and glasses, because all of our diabetic patients have to have a yearly eye exam. And so there's a large Hispanic population, and when I was studying for my boards, this was a board question, after the Pima Indians, what's the largest population of diabetics? Well, it's mainland Puerto Ricans. And so there's a large Puerto Rican population in the city of Deltona.
Yes, sir.
And so that being said, we have a lot of diabetic patients that we manage and we treat, and so that's another service that we're going to be providing for them. Together with the optometry, we're talking about bringing on behavioral health, because in light of COVID, the amount of anxiety and depression that's affecting our community, and the number of suicides and or attempted suicides has really increased, and so we need to provide that service to our community.
Do you see, and going a little bit into COVID, talking about that, is it because of the COVID? Because I've heard people they call it COVID brain, and they can't think right afterwards, and they just, emotionally they're off, and not so much about the isolation, but they're saying that, it changes you a little.
Well, from someone that did have COVID,
Yeah.
I contracted it in June of 2020, and I can tell you with certainty that is true.
Yeah.
It affected more my nervous system and not so much my lungs. So I didn't have any respiratory challenges, but I did have partial loss of my hearing. I had partial loss of my smell. I had partial loss of my taste. I had short-term memory loss. I had mental fog, mental fatigue. And although I was seeing my patients virtually, in my home office, I didn't have to go into the office to see the patients, but I had to keep notes of the conversations I was having, because I would literally forget from minute to minute what it was I was discussing with them. And so I had to keep notes and record myself to make sure that I didn't miss anything. So that is a reality.
Yeah, and thank you for sharing that, because as we've all been inundated with media and COVID, and everyone's like, okay, we're kind of tired of hearing about it. But there's so many people that ask these questions because they don't really talk about that. And we know that this pandemic, this disease, unlike any other, affects so many different aspects of your health. And I've heard a couple of my friends, and my CPA was one of them, she's like, ever since I had it, she's like, I just, and she's a CPA, it's tax season when she had it, and she's like, I can't think. I can't help my people.
Yeah.
And she's like, my mind isn't getting back to that. And,
I would agree with that statement. I had it in August, and I thought I was coming down with just a severe allergy reaction because I had been traveling. I was up in Connecticut. We had to go up there for a family reason, and coming back, I just wasn't feeling 100%. And the Sunday evening before I came back to the office, I was eating something. I go, uh-oh, I don't really taste this too much.
Yeah.
And so the following morning, I tested, and I tested positive. Now, mind you, I was double vaccinated, so I believe I was one of those outlier cases. But for me, same thing as Dr. Rosado. I wasn't sharp. So it took about a month to get my energy back to where it had been, So, but like you said, it affects everybody differently.
It's definitely one of the craziest things we've ever faced, I think.
It is, but it's making us better, and it's helping us, create and prepare for the future. And aside from those the services, we've got 2 other services that are going to be new to Family Health Source. We're going to have an actual lab on premises.
That's important.
So we won't have to send people out for labs. And we're going to have an X-ray department in our location. So again, we won't have to refer them out, because that's the biggest challenge. Patients get upset. We have to refer them to another location, and then the disconnect between that service, that partner and us, and getting the records back, or scheduling the patient to come back to go over the review the report, and they come back and we don't have it yet, or and then the faxing and the phone calls. So to avoid that, we want to do as much as we can in-house to minimize the possibility of, providing less than optimal care.
That's definitely what you want to do, because I know myself, I just went this week with my daughter, and it's like, okay, well, now we need you to follow up with this. And the follow-up, it's like taking the time off work, taking them out of school.
Exactly.
And if you can get everything done in one location and try and keep it in the same day possibly, it's a life changer. It really is, like literally. So that's great. And, I wanted to talk a little bit about, just going back to the COVID testing. You said the antibody, and explain that, because I know a lot of people said they thought they had it back in like November of 19. And are there ways to actually see if you had it already?
Yes, there is. There's a lab test. In fact, that's what Jason alluded to earlier, the antibody test.
Right.
When I tested positive in June, and I was ill for the weeks that I was, I couldn't go back to my office until I tested negative.
Right.
And so, of course, Family Health Source was available, so I went and got tested there. And the PCR was positive, so I still was positive. I couldn't go into the office. So I went back and did a PCR test in conjunction with an antibody test. Now these are tests that test for cell memory. So if you've had a disease or have been exposed to disease, you test one marker. If you actively have the disease, then that's another marker. Okay. Without getting too technical, you have the IgM, which means the acute phase, and IgG means that you had it or you were exposed to it.
Okay.
So when I went and got the antibody test, it showed that my IgM was negative, so I did not actively have the disease, but my IgG was elevated, which indicated that I was exposed to it, I did have it. And so that is the antibody testing.
Yeah.
Now what we're offering is antibody treatment, which is, as of right now, the only quote-unquote treatment that's available to prevent the progression of the disease. It doesn't cure the disease, it just prevents it from getting worse. 80% of the people that receive this treatment avoid having to go to the hospital and end up, with having respiratory issues, ending up in the ICU and ending up intubated and possibly dying. So 80% of the people that receive these 4 injections prevent them from getting any worse.
Thank you for that, because I think a lot of people still aren't understanding that and aren't understanding, like they get it and like, well, I'll just tough it out, I guess, or if I end up in the hospital. And they don't, while there's not a cure, there are these treatments.
There is treatments, that's absolutely correct.
Right.
And like Dr. Rosado said, they are very effective. We've got people that are on staff for their family members that have had this, and the recovery time is days compared to weeks or months.
I mean, they still have to quarantine, they still have to use their masks, they still have to, maintain social distancing like we're doing here. But in conjunction with that, we're building up their immune system so that their body has a fighting chance. But the best treatment is prevention. As Benjamin Franklin was alluded to, a stitch in time saves 9. An ounce of prevention is worth a pound of cure. So our prevention are our vaccines. And yes, we get a lot of pushback and a lot of negativity as we, announce these services on social media. But history has proven that it's the only source of prevention.
Absolutely, and like Jason, and it's funny because not funny, but Jason and I talked back when he tested positive. We had the opening plan.
Yeah, we were going to do a grand opening, and I had to postpone.
I told him, I said, well, what were your symptoms? And he's like, I thought it was an allergy, and I lost my sense of taste. And I was like, okay. So my daughter, at the same time, had come down being sick, and she was fully vaccinated, 16 years old. And the first couple of days, we thought she had a cold. And by Wednesday, she woke up, she's like, Mom, I can't smell. I went, oh, Lord. And so I took her and got her tested, and sure enough. But here's the thing. I feel like because she was vaccinated, it was so little symptoms, other than her being bored and isolated at home, it was just some cold symptoms.
Well, she's 16. She's bored,
she's
bored all the time.
Yeah, and then after 4 days, I think she was good. But, we quarantined her for the 10. And but, yeah, I do believe it's because she was vaccinated. And a lot of people say, well, she was young. They're healthier. But who would have known,
Exactly.
I'm a big advocate of it. I mean, I went and got it because I'm always in the public eye. I'm always social events. My daughter's like, I don't want you to die. So I got it. I believe in everyone's choice. It is your choice, but I do think it's a smart choice.
I think so too, and I was lucky. I was vaccinated. My wife and I are vaccinated. Like I said, my kids are very young, but I was the only one in my family that tested positive. So that's a good thing. You have the vaccine, and there's other benefits with it as well. If you do get positive, your symptoms don't seem to be as bad. And Dr. Rosado could probably explain more of why that might be. But there's so many benefits.
The same thing happened to us. We'd been on a trip that weekend. We ate and drank after each other. We were at the parks. My husband nor I got sick, and we didn't test positive, and we tested ourselves 3 times. But she did. And that's when it goes back to saying this has been a crazy, crazy thing.
It's been crazy.
And because of that, and thank goodness for the CDC and the FDA, we are now able to vaccinate children from the ages of 5 to 11 with a pediatric dose from, without dropping names, but the Pfizer.
Right.
Because we have to name it. Not that we're getting any money from them, but we have to name them. But Pfizer is the product that has been approved by the FDA and the CDC for children between the ages of 5 and 11.
Are you seeing a big turnout now?
We just started that this week.
Yeah.
So
I know that's been controversial.
We don't have the numbers yet, but we're on the verge. We will have numbers for the next time we come here.
Thank you.
My nephew got it, and he's 7. He just turned 7, and seems to be fine.
They probably took it better than us.
Well, they're so used to it.
They're so used to the vaccinations.
Yeah, exactly.
And that's one thing we talked about. I said, I believe it's everyone's right to make a choice for themselves. But I did bring up the fact that so many people are like, kids, no, we shouldn't make them do this. All of our our kids have to have vaccinations every year to go to school.
It's a laundry list. of
Right.
them.
So it's like, it's kind of crazy to me. But I wanted to get back on something you said and how, the misconception, and you and I talked about this, and Family Health Source and the type of people that go
Right.
there. And just let everyone know, we just talked about this before we started this morning, that I have insurance, but my insurance has a $7,000 deductible, right?
Which is usual.
So
Yeah,
right now.
I put
especially
off
in
going
today's
to the
world.
doctor because it's going to be so expensive anyhow until I reach that seven. So Family Health Source helps people like me because your services are a lot less.
They are. So to kind of elaborate, we accept all major carriers. But we also accept people that are uninsured.
Right.
But for people in your position that have extremely high deductibles that they have to meet, we have something that's called a sliding fee scale. So you can, even if you have insurance, you can still qualify for a sliding fee scale.
Okay.
So what you have to do is, all you have to do is you prove your income, you list how many dependents you have, and it goes into our equation, which is governed by HRSA, which is our governing body. And if you fall between certain guidelines, your copay with us will shift.
Right.
So if you're uninsured and you have a couple kids and you make $50,000 a year, you might qualify
Right.
for our lowest slide scale
Right.
because you have the dependents. Or if you're just a single person by yourself and you make $15,000, you'll still qualify. You'll be able to afford health care. I think our lowest slide is $25, I believe.
Yeah.
For the office visit.
For an office visit.
Yeah.
So you can come in, get access to good quality care, amazing care, and
in a state-of-the-art facility.
yeah, in a brand new facility. And when we say this, you guys have to come on Wednesday. You'll be blown
Please,
away with
yeah.
what we've done over here and what we're going to do. But $25 gives you access to great, amazing care. And on top of that, and Dr. Rosado can elaborate, we have something called a 340B pharmacy program that allows us to offer prescriptions to the general public and to our patients at what would be considered a discounted price. Now, we can't disclose our prices.
Right.
We're not allowed.
Right.
It's against our guidelines. But once again, it gets put on a slide scale. So
Yeah.
some of them will end up being free. Some of them are just a couple dollars. But for people that they get scared, like, oh, if I go to the doctor, it's going to be $100. Then my
Yes.
prescriptions are going to be another couple hundred. That's just not the case with us.
And that's why I want to bring this up, because I know there's so many people out there who are avoiding going to the doctor, that even though they know they really need to, because they think, oh my God, I can't end up in that kind of debt. I want you to know there are places like Family Health Source in your community that you can afford. They will work
Exactly.
with you, and don't put it off. Your life's important.
Even if you can't afford the $25, we'll put you on a payment plan.
Right.
$5 a month.
Right.
I mean, we as a community health center, and we're actually called a federally qualified community health center.
Right.
We get away from that because people automatically assume that we're federally funded, but that's not how we operate.
So I want to ask you all, I know that, not every medical facility, and I know you're a community health source, but you guys have a whole board of people in this community who back Family Health Source. Can you
Correct.
tell me more about that? Because a lot of people don't know the difference between a regular doctor's office and what you all do.
So, Dr. Rosado, should that be me or you? Me. So we do have a board that's made up of members of our community, and they're all members of the community. There's city commissioners. There's some of our board members work for some of the local hospitals. Some are just members of the community, but we answer to them. Anything that we do has to have board approval.
Right.
So we are here to serve our community, and if we don't, they quickly realign us.
Right.
Luckily, we have a very passionate CEO who understands the mission. We don't have to be realigned very well because the leadership team that she's put in place understands the mission, and we work well together. So we have weekly meetings. The leadership team has weekly meetings. Dr. Rosado, myself, the other directors of the company, we take that and we run with it, and whatever it might be. And there's all sorts of things that we do for the community. Something that we don't ever get any press about, but it's worth mentioning. Every inmate in Volusia County that's received a COVID vaccine has happened from Family Health Source.
Really?
When they didn't have anybody to look to, they turned to us, and without missing a beat, we were there.
That's
Rosado,
awesome.
we're there once a month now.
Yes.
Once a month, we're there vaccinating inmates.
That's awesome.
And think about that high-risk population.
Right.
You have thousands of people
yeah.
living on top of each other.
Yeah.
And they were just overlooked in the community. And they reached out to us, and we said no problem.
That's amazing. And I brought it up because I want everyone to understand the difference between, like I said, you all have doctors' offices that you go to. They're wonderful people, but I just want you to know what this organization is about. They are all about community. So
It's
that's what was
100%
really
about
important to
community.
me. Is there anything else you want to hit on, Dr. Rosado?
Yes, the point on the 340B program for our medications, that's a big challenge and a big, what do you call it, rate limiting step, borrowing from my chemistry days. But it's what blocks a lot of people from getting
Yes.
care, because they come into the doctor's office and yeah, they may have the $25, but then do they have the $200, $300 to get their medications?
Yeah.
And so a few weeks ago, I was shadowing with one of the providers, because on a quarterly basis we do a peer review. And so as medical director, it's my role to go in and follow the doctors and just be part of the community and hear the challenges with the patients and so forth. And the last patient of the day comes in, brand new patient, comes in with what's called a bronchial asthma exacerbation. He's an asthmatic, didn't have his inhaler, had run out, not insured, comes in, and I mean, I could hear him wheezing from across the room. I didn't even have to pull out the stethoscope. I could hear him having major issues breathing. So we do a breathing treatment for him right there on the spot. We give him a shot of steroids to help him breathe. He's feeling better, and so we give him the prescriptions that he needs, which include his inhalers and some other medications to support his breathing. And he's looking at it, and I went to an online company that provides coupons for individuals, and I'm looking at the prices, and just the inhaler alone was $100.
Yeah.
With that coupon.
Yeah.
And I'm scratching my head, and I'm talking to the provider, and we're trying to figure out what we're going to do. And then at the same time, the light bulb went off. It's like, well, we got the pharmacy right here. Let's go talk to the pharmacist. So we go across the hall, and we take the medications that we want to give them, to the pharmacist, and she runs it through the computer and the formulation that Jason talked about. And he was able to get all of his medications for the price of one inhaler outside in a regular pharmacy. And when we told him that, and he went and walked out with all of his medications, I mean,
Tears.
He was just so excited and happy that he was able to know that he had his medications and it didn't break his bank.
I'm agreeing with you so much because my mom, she passed away last year, but before she passed away, she had lung cancer, but she also had asthma for years. And even with Medicare, her inhaler medicine a month got to be $240. I mean, and so, I can see where this man was probably almost in tears leaving. And that's what I said. A lot of people are putting off healthcare because it has gotten, I don't know, it's so expensive, but also I know when the insurance changed from and went to Obamacare, I mean, I used to spend like $800 a month on insurance for the family, $900 maybe pre-tax, but I had $25 copays, $99 for the emergency room. So I didn't mind as much. Now, I'm spending $300 a month, but I have a $7,000 deductible. So I'm putting off care where normally it would have been like, okay, $25, let's go see what's wrong.
Well, and that's the part of the issue today. So any of the plans that are decent plans, they're just not affordable anymore.
No, they're not.
So that's why our service is so, it's so important to the community, because we allow the people that fall in that gap of, they don't qualify for any of the programs here. They don't make enough for any
average working people.
Yeah. I mean, there's no reason why your health care should outweigh your mortgage or your rent. And unfortunately, that's what happens.
It is.
So those are the people we're here for.
And we have an outreach department. Sorry to cut you
by all
off.
means. I was going to go.
We have an actual department that sets appointments for these patients that come in from the community that have no insurance or need, like yourself, that need some support and some understanding on the whole gamut of, marketplace versus Affordable Care Act versus Medicaid versus what's available for them.
It's confusing.
We have people in every one of our locations that sit down with these, and they're all bilingual, so they speak English and Spanish and are able to help them. And if they come in speaking a language that we do not have anyone in the office, we have a program that is a translating program that we connect to, and that speaks French, Creole, Chinese, etc.
That's
There's
so
150 different languages that you could speak to this program, and it's
And in this area, we need it because we really are a melting pot in this Central Florida area.
That is true.
So many people move here.
That's true.
So, well, you guys, I want to thank you so much, Dr. Rosado, and I want to thank you so much, Jason.
No problem.
I got
Thank
the
you,
last
Sherry.
name right. But yeah, thank you, Jason. I really appreciate you
it's been a
guys coming
pleasure.
out today, talking about doing business here in Deltona, talking about Family Health Source, which is all over Volusia. They're a great resource. You want to check them out. We are going to be March 17th at their facility.
November
November
17th.
17th.
November
November
7th.
17th.
November 17th, we will be at Family Health Source on Deltona Blvd, 5 to 7 p.m. doing a grand open ribbon cutting. Come see the facility. It's amazing. And really quick, just to throw in one other thing about the city of Deltona, the Chamber is hosting at the Center at Deltona on November 30th. At 8:30 in the morning, breakfast starts. 9 to 10:30 will be their State of the City. If you want to find out what's going on here in Deltona, they are going to make some great big announcements. So please go to our website and register. You want to be a part of this. Thank you so much and have a great day.